The World Health Organization recently released its report after evaluating the carcinogenicity of the consumption of red meat and processed meat. They classified the consumption of red meat as probably carcinogenic to humans based on limited evidence that the consumption of red meat can cause cancer in humans, mainly colorectal. Processed meat was classified as carcinogenic to humans based on sufficient evidence that the consumption of processed meat causes colorectal cancer. What does that mean for the citizens of Trinidad and Tobago? The Ministry of Health held a press conference to bring awareness and give some context to the findings and how it relates to our lifestyles.
The question that is on the lips and minds of all Trinidadians and Tobagonians is, should I eat ham for Christmas? And the answer is yes, you can eat ham for Christmas. But as Mr. Constant said, it is a responsibility of the Ministry of Health to note these reports and to give a studied report to the nation as to how we as Trinidadians and Tobagonians should adjust our lifestyles. So the report has to be contextualized. And for instance, if you looked at the report, you would see that eating red meat, 100 grams of red meat a day, you increase your chance of colorectal cancer by 17%. But does the average Trinidadian eat 100 grams of red meat a day? And the answer is probably no. The average red meat consumption in a country like the United States, yes, the average male there may consume 100 grams of red meat a day. So they need to pay more attention to those reports than we do. In Trinidad and Tobago, we eat a higher proportion of white meat and fish. So I just want to contextualize that WHO report because I have noted in the media, social media, the formal media, the talk shows, that there's a lot of ambiguity about what this report actually means.
The Minister of Health sought to explain it further as he urged citizens to be responsible for their health.
The answer to all of these questions is not legislation, but the answer is common sense and personal responsibility and the relationship you have between your hand and your mouth. Because your hand is what puts these things into your mouth. And that relationship between hand and mouth, what you shovel into your mouth, has to be the focus of the conversation as we move forward. So the answer is not legislation. The answer is not panic. There's enough research to tell us that we ought not to have a diet rich in salt, sugars, fats, and red meats.
Acting Chief Medical Officer Dr. Clive Tilakdari gave some added statistics from the World Health Organization's report and stressed the importance of a good diet and exercise plan.
It is very important to understand that this classification means that eating processed meat and red meat can cause cancer, but it does not indicate a chance of actually getting cancer. We know that many agents can cause cancer, for example, cigarette smoke, alcohol, and even sunlight. But the actual risk of causing cancer is obviously different for each. Now, let's take a step back a minute and look at some of the numbers. Now, a person's lifetime odds of getting colorectal cancer, which is cancer of the colon or the rectum, is about 4.5%. This IARC evaluation estimates that eating 50 grams of processed meat each day, which is equivalent to 1 hot dog or 2 slices of bacon, can increase your relative risk of colorectal cancer by 18%. What this actually means is that a person can eat 1 hot dog every day, but would have a 5.3% chance of getting colon cancer in their lifetime, compared with a 4.5% chance for someone who does not eat hot dogs at all. So it is clear that typical dietary patterns of different countries carry different associations with cancer. In some Asian countries, there is a relatively high incidence of stomach cancer linked with the consumption of smoked meat, for example, in Japan. It is thought that some Mediterranean countries report lower rates of cancer than the United States of America and the United Kingdom, due to the traditional Mediterranean diet, which is high in fruits, vegetables, and beans, and relatively low in red meat and processed foods. So if you want to know what kind of diet will reduce your risk of cancer, it is the same diet that will promote good health or good heart health.
According to PAHO, Trinidad and Tobago has one of the highest cancer mortality rates. Dr. Dylan Narayan Singh gave a highly informative presentation on cancer and how it relates to each and every citizen.
A carcinogen, very simply, is a substance that causes cancer. In the classification used by the IARC, there are 5 groups of substances, and in Group 1, it tells us that there is sufficient evidence that the substance causes cancer. Substances that fall in this category all include cigarette smoking, radiation, alcoholic beverages, and now processed meats. In Trinidad and Tobago, the number of colon and rectal cancer cases are on the rise, and it is the 3rd most common cancer amongst men and women, affecting 1 in every 8 persons. Colorectal cancer is a cancer that may present with symptoms, some of which may include bleeding from the rectum, change in bowel habits, anemia, commonly known as a low blood count, or it may be asymptomatic, meaning that no symptoms are present at all. Colorectal cancer may be caused by many different factors, including hereditary factors and diet. Colorectal cancer is a cancer that screening is recommended for, and current international guidelines recommend routine colonoscopy after 50 years for men and women. So the take-home message from these guidelines would be to decrease your risk of cancer and invariably heart disease. Eat a diet with less red meat, choose poultry and seafood instead, and increase your fruit and vegetable consumption this festive season.
Every member of the panel stressed the importance of feeding our bodies nutritious foods that would help ward off disease in general. And this was further emphasized by Taryn Phillip, manager of the Nutrition and Metabolism Division.
How can we prevent cancer, and what should we be eating, right? Which I mean, because when we speak of healthy diet, it's really all about moderation, right? Red meat is a good source of nutrients such as your protein. It's high in like your iron, your zinc, and like vitamin B12, right? So it's not per se a bad food, but because of the effects of the cancer, so we have to look at how much we would actually eat. Now, based on recommendations from the World Cancer Research Fund, they recommend that you can eat 2.5 ounces of red meat on a daily basis. So that looks like this. So this is actually ham. So this is what, like, if we had to eat ham for Christmas, this is the slice we would want to actually have, right? No. One of the things is they are saying that we can have ham every day, but based on a healthy type of diet, we want to really have like red meats and the processed meats at least 2 times a week.
For more information, please contact the Ministry of Health at 627-0010, extension 1605 or 1607, or through their website www.health.gov.tt.